It is slightly over 2 years since the Covid-19 pandemic, and the virus continues to prove challenging to contain. Even with the vaccines and COVID boosters available, the virus keeps mutating, making it harder to mitigate. But what you may not know is that while the virus poses a serious risk to the general population, it also poses a significant risk to healthcare workers. Health professionals are 6 times more likely than the general population to contract COVID-19. Yet, there is a bigger, more subtle threat to doctors and nurses that no one talks about. In this video, we will look at the impact COVID-19 has on the mental health of healthcare workers. Many nurses are on the front line of the COVID-19 pandemic, caring for patients who are often sick and anxious. However, as the pandemic progresses, nurses and doctors are reporting high mental health issues. Among healthcare workers treating patients with COVID-19, a recent study reported high rates of depression at 50%, anxiety at 45%, insomnia 34%, and distress at 72%. These statistics are a cause for concern because they directly impact the quality of care. So, to ensure healthcare workers can provide the best possible care, it is critical to understand the causes of these high levels of mental health issues. Why are many healthcare workers affected from the pandemic? Some of the potential causes include long work hours, lack of sleep, and exposure to COVID-19 patients and their families. Most hospitals were and are seriously understaffed, leading to most healthcare workers being overworked. Working over 12-hour shifts is not uncommon. Most healthcare workers do not have enough time for rest and other activities. This most definitely has had negative effects on their mental health. Another crucial factor contributing to mental health issues is witnessing mass deaths daily. Nurses and doctors are no strangers to watching patients die, but the COVID-19 situation has had its toll. The fact is, seeing many patients die due to the virus has left them feeling hopeless and devastated, not to mention the isolation and watching families struggle to cope. During a COVID-19 wave, the hospitals get so busy that patients die even before they are attended to. This has had a significant impact on the healthcare workers' mental health. Separation from family members has also been a painful blow. During the thick of the pandemic, nurses and doctors could not see their families as frequently as they used to because of their busy schedules. Some had to stay away from family for fear of spreading the virus. The greatest challenge for anyone dealing with mental issues is isolation and lack of a support system. For healthcare workers, finding emotional support has been challenging. What can we do to help? To actively assist healthcare workers, our healthcare system's most valuable assets, we must first understand their concerns and needs. Work-related psychological issues such as burnout are unavoidable occupational hazards. By recognizing the psychological effects of caring for COVID-19 patients, we may reduce work-related mental health concerns and help more nurses and doctors cope. We're running a project for nurses and doctors through Demic. If you have a pandemic-related story or encounter you would like documented, reach out to throughdemic.com to feature.